Hello, I'm Kirsty Graham, and I'm the CEO of Edelman Public Affairs and the Global Chair for Edelman Health. I'm delighted to be here at South by Southwest, and I'm particularly grateful that we are joined today by our special guest, Dr. David Nabarro from the World Health Organization, who is the Special Envoy for COVID-19. Before I hand over to Dr. Nabarro to give us a status update on the virus, I just wanted to say a little around the findings from the 2021 Edelman Trust Barometer. Now, some of you know we have been studying trust for a long time, more than 20 years, and we have surveyed more than 33,000 people across 28 countries. And we look at 4 institutions. We look at levels of trust in government, in business, in NGOs, and the media. And we always knew that 2021 would be a really interesting survey, and the results were indeed extraordinary. Let me just say a couple of things about what we learned. We learned that on top of having a pandemic, we also have a real problem in an info-demic. We saw record lows in trust in media across digital, across social, earned, and traditional media. Record lows, as well as people's trust in search engines. We also saw the trust spike that we saw for government in May really decline globally. And interestingly, business emerged as the most trusted institution. Indeed, the only institution that was seen as both competent and ethical. So really interesting findings, and we're going to come back to this role of what business can do in this time of a pandemic and an infodemic. But before then, I actually want to go straight to you, Dr. Nabarro. It's terrific to have you here. Thank you for your time. And to ask if you could give us an update of where we are with the virus right now.
Thank you, Kirsty, and greetings to everybody. First of all, I have to be clear, we are in the midst of a really serious pandemic caused by a dangerous virus that is changing in front of our eyes and challenging us, and is set to do so for quite a lot more months, even years. I look at this pandemic as a worldwide phenomenon. I look at what's happening in different countries around the world. I follow the surges and then the declines in the numbers of people reported with COVID, and also I study the information about overload of health services and sickness and deaths of people. Now, during the last few months, we've seen a huge increase in the numbers of people reported with COVID each day. Do you know, it's nearly 500,000 a day. But the good news really recently is that in some parts of the world, the numbers have come down. They've come down quite strikingly. They've come down in Western Europe. They're coming down in North America. And the reason for that is that really there's widespread changes in people's behavior, so that they are distancing more from each other, they're wearing masks, and they're also practicing much better hygiene and isolating when they're sick. And that's great. But can we keep it up? Can we keep holding this virus at bay through the way in which we behave? Can we keep the public health services that identify those with disease and make sure that they are not only isolated, but their contacts are traced and then they're isolated? But can we keep that up for the foreseeable future? Or are we going to get really frustrated with all we're being asked to do and really wish that this virus would just go away? Well, the evidence that we've got is that people everywhere are saying we've got to take this seriously. We've got to act in ways that make it hard for the virus to get around. And perhaps the most important thing, Kirsty, is a recognition that people are the solution. It's us. It's all of us. Rich people, poor people, people in all countries, people in all walks of life. We have it in our hands to be able to hold this virus at bay. And not only that, to keep it at bay so that we can get on with our lives. The challenge is dealing with the mutations that are coming along, because they are actually changing the virus, and they're making it in some ways quite difficult because they increase transmissibility sometimes, and other times they're a bit difficult to contain with the preventive measures we have. And then there's vaccines. They've been made in record time through extraordinary cooperation, and we've got some super vaccines around, but we need to work out how best to use them, and we need to make sure that they're distributed as fairly as possible. So that's my quick report. A serious pandemic, but really organized people in so many parts of the world, just all coming to the conclusion that we have to work together to get on top of it. And some governments also finding a way to work better together. And as you've said, business leaders increasingly trusted because they also want a world where the pandemic is not causing so much trouble, so they can get on with doing what they know how to do best, running their companies. Thank you.
So, Dr. Nabarro, that was just such a great pithy summary. I mean, you know, good news and some more challenging news in there, as you say, as you talk about the mutations, you talk about where we are with the vaccines, and I think that you make such a good point that, you know, people are the solution.
Yes.
And I just want to use this time to just quickly show 5 really interesting slides from our Trust Barometer, because I think they underscore this connection around trust, the human element, and what we're going to have to do to maintain, as you say, these public health practices and have people trust information and make sure they're getting it from the right places. Let me begin by showing this one. I think this slide is very interesting. We came up with this idea of looking at information hygiene practices, knowing that we're in this info-demic, and saying to ourselves, what is the definition for that? And you'll see on the left, we've got 4 ideas, making sure that you are getting news from a variety of sources, making sure that you avoid being in an echo chamber where you're getting your information, making sure that you verify it, and perhaps most importantly, making sure that you don't amplify or spread information that is not in fact vetted. And this is a really interesting point, because if you look at this and people were asked how they feel about their own information hygiene practices, only a quarter believe they are practicing good information hygiene. And this becomes really important when you look at the correlation between how someone identifies with their information hygiene practices and correlated against a willingness to be vaccinated. And we see an 11-point difference between those who say they are willing to take the vaccine and say they have good information hygiene habits versus those who don't. That's a significant number. And if you look at this chart, there are actually 16 countries where there is indeed a double-digit gap. And if you look at this from an economic standpoint, some of these countries are among the world's biggest and most significant. You look at the UK, US, India, France. So we have got some very significant things to manage here. And, you know, David, we were talking about what is the role of leadership in this space. I thought this was a troubling finding from the report, that really trust in leaders, no matter where they sit, is down globally. Leaders and media are actually suspected of lies and information themselves. This is the percentage of people who believe that they are purposely being misled, or that people are saying things that are false or exaggerated. 59% believe that is true of journalists and reporters. 57% believe it of our government leaders, and even 56% believe it applies to business leaders. But here is an opportunity for business to bridge that divide. And this is an interesting shot of what we see in the US. This is US-only data. But look at the delta between Trump and Biden voters in terms of levels of trust for NGOs, for government, and the particularly significant one of media, which is almost a 40-point difference about trust in media. But above all of that, in business, they are even. So regardless of people's personal politics, they trust business. And this becomes quite acute when there's an expectation of CEOs to lead on social issues. A full 86% of global respondents said they expect CEOs to speak out on these challenges, on the pandemic, on job automation, on societal issues, and local community issues. We also know that people expect CEOs to step in place of government, so they see the role of business in creating a more trustworthy world as significant. And they also expect CEOs to be accountable to the public and not just to shareholders. And that finding was almost 7 in 10. So, Dr. Nabarro, when we look at these trust measures and we think about what we're dealing with in both the pandemic and the infodemic, we see these challenging numbers about trust in leaders and trust in the media and how this impacts the willingness to be vaccinated. So I'm curious, how is the WHO partnering with different groups to address this infodemic?
Thanks very much indeed. I mean, I think what we've decided, and it's something that we've felt right since this started, is that we've just got to tell the truth as we see it. And we've got to be consistent at doing that. And we know that for some people, this truth is not an easy truth to hold in their own hearts. But that doesn't mean that we should change. In fact, we think that those who offer false hope, unrealistic targets, or particularly those who deliberately set out to deceive, really are the source of the problem, the source of the mistrust. So we're saying, let's just tell it as we see it. And that means we have to be clear. This pandemic has no good features to it. It's a really terrible thing. And it's turning lives upside down everywhere, particularly lives of poorer people. Dealing with the pandemic is hard work. It involves sacrifices. It involves changing our lives. It involves deliberately not seeing or being with those we love for months on end. It's full of uncertainty. You know, we're always being asked questions about the vaccines. Do they work against the variants? How to make sure that we can get them to everybody? We just have to be honest. We're facing some tough challenges, a real shortage of supplies right now. And we do have to connect with people. We found out just how many hundreds of millions of people have been made poor as a result of this pandemic. How many jobs have been lost? How many sectors are facing contraction? And we have to just look people in the eye and say, yeah, we get it. Not with any false sympathy, but trying to really project a sense of authenticity. And of course, we ask people to help us. If we can find CEOs of companies, if we can find people who are sort of well-known figures in society, we'd like them to help convey our message. But most importantly, Kirsty, there's just one basic principle that we adopt. We tell it like it is. We tell it like we see it. And when we think we've got it wrong, we say that too.
I think that's incredibly important to hear, tell it like it is. And I also think that it speaks to something we've been reflecting on as we looked at this data, that you can speak in facts and be empathetic. They are not mutually exclusive. And this desire to come back to science, come back to facts, and know, and also think about how people are feeling through this. As you say, it's been a long time. It's going to be a lot longer. I wanted to get your thoughts on mandatory vaccination. You know, we've seen some commentary around some companies who might be considering making vaccine mandatory. How do you feel about that, and what do you think that would do for vaccine uptake?
Well, I don't personally believe in any mandatory prescription of public health action. And I certainly don't feel that about vaccines or treatments. I think there's a case for saying that people have to have a test before they take a plane, or they need to do wash their hands before they go into a building. That sort of mandatory action, I think, is legitimate. But requiring people to have a biological substance put into their body as a requirement, I think, is a much more difficult space, especially because we know that there are some people who are quite nervous about these vaccines produced at great speed, very great speed, in an environment of many unknowns. So I would seriously ask any CEOs who's considering requiring personnel to be vaccinated to be very thoughtful about it, and really to consult with staff representatives in great detail, and to ensure that there is a level of consent, and also to connect with the local authorities in the place where this is being planned, because it may well turn out that even the local authorities have a view. And so in general, I would say only in the most exceptional circumstances would I understand the requirement that there is mandatory vaccine for employees.
I think that also underscores what you and I have spoken about on many other occasions around this building trust, making sure that people have the right information, that people are educated on vaccines and on what is happening in this space. Do you know, when you've been watching this pandemic for so long now and thinking about the roles of various groups, how do you think business can help manage this info-demic we're in? How can business make sure that the information is getting to the right people, that it is factual, and that we try and get a handle on the misinformation that is out there?
Thanks so much. I'm really interested in the results of the trust barometers that you've been doing during this period of the pandemic, and particularly the one that was released just last month. I'm not surprised, though. Mm-hmm. I think the reason why there's such a high level of trust for business leaders is that basically people know that a business leader has to have very, very clear value sets, and those value sets have to be demonstrated in all aspects of the person's work. So, for example, if I'm running a business that involves a lot of contact with the public, I have to make certain that the public are confident that our contacts with them will not expose them to disease. So it's in the business leader's interest to give me a safe and secure experience as a customer. And that's because if the business leader doesn't do so, that business will go under. I mean, just imagine a particular business is associated with an increased risk of employees or the public getting COVID. They won't be trusted. And so I think it is the single-mindedness of many businesses and the laser-like focus of many of their leaders on the well-being of employees, of customers and others with whom the business has contacts that makes them trusted. And therefore, I would like to really ask business leaders everywhere to get into the business of actually offering really up-to-date and accurate and reliable information to all people that are in contact with the business. I'd love the businesses that perhaps are looking at this to get known for the trustworthiness of the information they provide. I'd like them to be go-to places, and I'd like to work alongside them as much as I can and offer my support, because I think we who work in public health need to really yoke ourselves to any group that is capable of delivering messages to the public and then at the same time being trusted for delivering the right messages in the right way and with the sort of authenticity that you just talked about.
So I think that it's a really, you've said so many things there that really resonate. And I just wanted to ask you a final question. You know, with all your years of experience in the WHO, what do you take from this in terms of the most successful messaging and tailoring around vaccine issues? What works really well?
I think the most important requirement is to recognise that the term vaccine hesitancy is a really very good term to describe what an awful lot of people feel about these amazing vaccines that have been produced at breakneck speed to deal with a totally new threat that we don't fully understand. Essentially, people are hesitant because they actually understand quite a lot about vaccines, indeed quite a lot about medicine. They say, we don't know very much about this virus. We don't know an awful lot about these new vaccines, but we put a lot of hope in the technology and in the scientists who develop them. We're hesitant because we're not sure. So give us a little bit of time to look and see what happens to our friends and our neighbours when they're vaccinated. If they don't have any side effects, come back to us in a month or 2 months and we'll reconsider. So the lesson is, yes, the hesitancy is there, but it's there because it's real. It's real because the folk who are hesitant have legitimate anxieties, but they're ready to rethink their anxieties when they've seen over time what happens to others who receive vaccines who are not so hesitant. So then we give them several chances. We show that we understand why they're hesitant. And most importantly of all, we welcome them to come and receive the vaccines or treatments or other approaches that we offer when they are ready. We don't make them feel bad for it. We don't make them feel any sort of inadequacy. We simply just totally level with them and understand them, because their hesitancy is totally explicable, at least to me and to my colleagues in the WHO.
But Dr. Nabarro, I just want to thank you because you've said so many really important things here. I know you have huge demands on your time, but I think you bring this perfect mold of, the need to have facts, but also to educate and bring people with you. And I think it is underscored by so many of our findings around the importance of trust and leadership and the role of every party, not just business, but government, in getting people to that space, and also recognizing that people need to see the values that people hold and see the actions that underscore that. So
Absolutely.
People are indeed the solution, and I just want to thank you for giving us a lot of very practical advice as we continue this journey. Thank you for your time.
Thank you. Oh, great. And let's keep working together, Kirsty. Thanks a lot.
Thank you. Bye-bye.
Bye.